Hello, and good evening, and welcome to the Long-Gevity Lounge. I'm Dr. William Long, a physician with NDVIP in Charlotte, North Carolina. My career has been spanning 40 years, primarily in family medicine and geriatrics. My career has included outpatient medicine, inpatient medicine, long-term care, hospice, and even a 10-year run in clinical trials and research. In my 40 years of medicine in the trenches, this has given me a front row seat to the absolute best and worst that humanity has to offer. This podcast is a product of years of being asked repeatedly by my thousands of patients what they can do to not only live longer, but also to live better and avoid the incapacity that so many of them have seen in their parents and grandparents in their latter years of life. Tonight I'm going to start my podcast adventure by speaking to one of the more terrifying issues in medicine, and that is Alzheimer's dementia. Sadly, most patients over the years have come to see me only after they begin to have a symptomatic illness. I want and hope to start changing this mindset and have my patients and anyone who will listen begin caring for themselves long before they develop major health issues. With the dementias, witnessing it firsthand during my 40 years in the long-term care setting, I've had to watch once productive people, many of whom I had known for decades, have their minds wither, being reduced to lost souls, shells of their former vibrant and productive selves. Dementia has a lasting impact, not only on the patients themselves, but their entire circle of family, friends, and colleagues. We've all witnessed this firsthand. Let me start by stating that dementia and its cognitive or memory dysfunction starts decades before we start to witness any of the memory loss symptoms. I will try and keep the nomenclature and medical terminology to basics, but there are several types of dementia we hear about, and most of us have heard, most notably Alzheimer's dementia. There's also dementia with Lewy bodies, and there are other illnesses that have associated dementia, such as Parkinson's disease and Huntington's disease, to name but a few of the more common. The evaluation of individuals starting to show symptoms of decline in memory can include imaging of the brain with MRI, which you've all heard of, CT scans, labs, and more recently genetic biomarker blood tests being available. Sadly, only about 5% of the individuals seen with these early memory problems have a fixable or reversible cause of their memory loss. Frequently, cognitive or memory testing will be done, with the most extensive memory testing being very time-consuming and requiring experts to properly interpret these test results. Fortunately, through the hard work of pioneers in memory loss or dementia, people like Dr. Isaacson, who I was blessed to hear speak very recently in Washington, D.C., have now shown that based on ever-increasing evidence that dementia can be prevented, or at least delayed in its onset. Many factors have been shown to contribute to the development of dementia. As we might expect, age seems to be more popular, prevalent in elderly people, our genetics, and environmental factors all playing a significant role in the onset of this memory loss problem. Let's start a discussion of Alzheimer's with some discussion of genetics. Many of us can become concerned when we have a family member that becomes impaired with memory difficulty, If someone you have close to you or related to you develops dementia or memory problems at a young age, say before age 65, you can now have genetic testing done, checking to see if you might possibly carry certain genes that would put you at a much higher risk for developing Alzheimer's. Many of us have had this done, not thinking about it, by companies such as 23andMe, Ancestry. I did this several years ago, but not because of my concern about having dementia. Regardless, I just wanted everyone to know that these types of tests can be performed rather easily today. To speak briefly about the genetic terms you may hear or see when you read about dementia, I would simply say that the ApoE4 genetic type is the one that causes an increased risk of Alzheimer's. To oversimplify, we'll say we all have a ApoE gene, but having 2 copies of the E4 subtype does cause an increase in your risk of developing Alzheimer's dementia by somewhere between 9 to 12 times more than those without this gene subtype. Again, not to belabor this, but the other genes you may hear about would be the E3 or E2 subtypes, with the E3 being the most common, normal, people of average risk, most of what all of us here would have today. The E2 genotype, which is much rarer, shows some mild decreased risk. We could devote an entire podcast to this subject alone, and I may consider doing this in the future, but not today. It's something you may hear, and I think you should at least be familiar with the terminology. The main reason for talking about this and why I would recommend this type of testing, particularly in younger individuals at risk, say with a family member very early in age getting dementia, is simply put, you have 20 to 30 years to alter the course of this disease long before it begins to cause you any significant memory loss symptoms. Over my long career seeing patients with Alzheimer's dementia, the disease was and has been characterized by the accumulation of a substance in the brain called amyloid beta. Amyloid beta has been noted and present in the brains of individuals with the diagnosis of Alzheimer's dementia from its first being described many, many years ago. In addition to the presence of this substance, a second substance called tau is present in many of the patients with Alzheimer's. This substance has been shown to be a cause of inflammation to the brain cells, or neurons, the cells that are required for our brain to function properly. With these proteins frequently being present in the brains of many individuals with Alzheimer's dementia, it was not much of a leap to believe that amyloid beta, the protein, was likely causing the brain to be damaged and the actual cause of Alzheimer's dementia itself. The thinking had been, if we could slow the accumulation or even remove these amyloid plaques from our brains, we could slow or halt the progression of this brain-damaging disease process. Unfortunately, all the clinical trials during my career have not shown this to be true. I admit I've tried all these medications, many of them being recommended by our medical experts over the years, but have rarely, if ever, seen much of an improvement in any of my patients. Sadly, none of these amyloid plaque-reducing medications have been shown to be helpful. In 2021, an amyloid targeting drug was approved by the FDA, but most insurances will not cover it and has been really shown to be of minimal help in improving patients' symptoms. this continuing cascade of amyloid-reducing drug failures has increased the doubt in many providers' minds of the singular role of amyloid as the cause of Alzheimer's dementia. Numerous recent studies using technologies such as PET scanning have shown that many patients are developing dementia without these amyloid plaques in their brain. And similarly, numerous studies have shown the presence of these amyloid plaques in individuals who have no signs of dementia. These findings strongly suggest that there are other factors causing the development of this brain disease called Alzheimer's. Since we sadly have no effective treatment for Alzheimer's, we now need to start to talk about a plan of prevention. Dr. Richard Isaacson, who we mentioned earlier, has published many papers, one in 2010, on Alzheimer's treatment and prevention. This was very controversial at the time, but has since gained strong scientific support by many over the past decade. There's been other work done and completed, most notably a study in Finland in 2015, beginning to show that even high-risk individuals can be helped in maintaining their cognitive or memory function by employing nutritional strategies, physical strategies, and cognitive strategies to slow or stabilize cognitive function. These are signs of real hope for a previously hopeless illness. Unfortunately, most medical providers fail to intervene with any treatment until their patients are showing early or obvious symptoms of memory decline. This approach needs to stop, and I'm confident, armed with this type of information in your hands, we can change this approach and help our medical providers become more proactive, implementing strategies years before the problem is apparent to everyone. Let's talk about individual risk factors. Unfortunately, women of Caucasian descent are at a much higher risk of having this bad ApoE4 gene. Overall, about twice as common than the rest of the population. Another factor in women that is becoming very interesting and more apparent, and a very high interest, is that with the onset of menopause, with its rapid drop in the hormone estrogen, we can see an acceleration in this brain injury, particularly in the women that are unfortunate enough to have this ApoE4 genotype. Scans tend to show a more rapid accumulation of the inflammatory marker we talked about earlier, tau, in these individuals, suggesting an increase in damage to the brain cell neurons during menopause. Very interesting area, and we'll probably revisit this in another podcast. Again, I want to emphasize Alzheimer's dementia has a very long prologue, long time before it starts, probably 20 years before symptoms appear, which give all of us adequate time to attempt to alter this disease process. This very early memory loss has been called MCI, or minimal cognitive impairment. I mention this because it's a term you will hear. It is also believed that even MCI may actually be occurring after an even earlier stage, now called stage 1 or preclinical cognitive decline. The stage is typically characterized by an alteration in mood, depression, and some early behavioral changes that maybe only very, very close contacts would notice. The message here is to identify these problems as soon as possible as many of our strategies to prevent dementia can be more easily accomplished during these times before very severe symptoms begin to take place. So if it's not amyloid beta, which we have thought for years, what could be the cause? Then what do we think is causing this damage to the brain of those individuals developing Alzheimer's dementia? Again, through the work of many individuals, most notably Dr. Delatorre, it appears the brain is being injured by a slow impairment or damage to the circulation of the brain, or in other words, a slow vascular blood flow injury. The brain is a greedy organ using much more oxygen, energy, and blood flow than all the other organs in our body. The brain is so greedy it is willing to sacrifice anything, including fat, muscle, bone, even other organs, to maintain its need for energy and oxygen. So even mild disruption of blood flow to the brain can cause major injury. Many of us have seen this firsthand in the ravages of a stroke, which is caused by a decrease in blood flow to an area of our brain. So perhaps Alzheimer's dementia is probably or primarily a blood flow disorder of the brain, a gradual decline in blood flow, creating a, quote, neuronal energy crisis. This means that the brain cells are not getting enough oxygen, not getting enough energy, and not enough blood flow. This even minuscule decline in blood flow over time will create a cascade of events that ultimately causes harm to our important brain cell neurons. This results in the production of amyloid plaques and eventual memory loss. Therefore, maybe amyloid and tau are not the cause of the brain injury, but are simply a byproduct of the brain's cellular damage. Some medical problems that affect blood flow at your brain and our heart, very similar organs related, and these are ones we know: hypertension, smoking, diabetes, hyperlipidemia, brain trauma, mood disorders, and generally an overall inactivity. Neuroimaging studies can confirm a significant decrease in blood flow with all of these risk factors. Unfortunately, individuals with diabetes, of which there are many, many in this country, have a 2 to 3-fold increased risk of dementia, making their risk similar to those people carrying a single copy of the ApoE4 bad genotype. Areas of the brain important in memory function, such as the hippocampus, are known to have a greater number of insulin receptors, suggesting these areas are even more vulnerable to injury from any type of impaired glucose or sugar metabolism. So similar to a decrease in blood flow causing injury to the neuron, similarly a problem with increased blood sugars and even the condition of prediabetes can starve our neurons or brain cells of the precious energy they need. This impairment results in a cascade of events that results in inflammation and injury from overall oxidative stress to the cell, and will eventually cause the mitochondria in the brain cells to dysfunction. I know we've heard this term mitochondria, but what these are important small little organelles within the cell that make energy, which is needed for the cell to stay alive and work properly. Without normal functioning mitochondria, the cells just do not work well. Other important work by Dr. Hossam, by investigating the ApoE gene, have given some insight into how the brain might become damaged. This ApoE gene, which we've talked about at some length, makes a protein, a small little protein, that is responsible for carrying cholesterol into our brain. I need to note that the brain is a very protected space, and what is allowed into and out of the brain is very highly controlled. This protein allows cholesterol and sugar much easier access to the brain itself. So things can get into the brain much easier using the ApoE. These individuals of high risk of bad ApoE-E4 gene have been shown to have a marked decrease in this ability to transport both cholesterol and sugar, glucose, into the brain, thus making the brain more susceptible to injury. To oversimplify this research, what appears to be happening is that the brain's inability to regulate blood sugar and other brain nutrients will result in the neuron cell injury, which is accompanied by increased markers of inflammation throughout the brain. So this impairment in both sugar metabolism and the inability to transport is what's causing the injury. So now, what can we do to slow or prevent this type of injury to our brains, knowing that abnormal metabolism and blood flow are probably playing such a large role in the brain cells' injury and damage? To put it simply, remember, what is good for your heart is good for your brain. So the same things we do to prevent heart disease, we should be doing to prevent damage to the brain. First, we must improve glucose metabolism, which in turn will decrease inflammation, oxidative stress to our brain cells. Things that would improve diabetic control will play this role. If you're diabetic, you must get excellent control of your blood sugars. And even for those non-diabetics, this may mean having an A1C of lower than 5.5. An A1C is a blood test that can be done. It tells us how high your blood sugars have been over several months of time. It's sort of an average test, not ideal, but it's the thing we use. For non-diabetics, we must monitor our dietary sugars or carbohydrates, as well as our fats. I'm not going to spend a tremendous amount of time discussing diets. We've heard so much about diet over the years. But of note is the Mediterranean diet. This seems to be the most useful in this regard, as this diet is high in omega-3 fatty acids, that is fish oils, and monounsaturated fats. Those are the good fats, as well as low in carbohydrates or sugar. Others believe that a ketogenic diet is useful as well, as it allows the brain to diversify its fuel source, to not only use sugar or glucose as fuel, but when needed to use a substance called ketone bodies, an energy or food source made when sugar cannot be utilized by the brain as fuel. In other words, this allows your brain, the brain, a more flexible fuel strategy. Note, as the neurons become increasingly sick, they become less capable of using sugar or glucose as their fuel. And their ability to then use ketones, this other fuel source, can protect the cells from further damage, inflammation, oxidative stress. I can't avoid discussing alcohol, and the evidence is mixed, but I tend to err on the side of caution and would probably limit alcohol to 1 drink a day, that is, say 4 to 6 ounces of wine and 1 to 1.5 ounces of hard liquor. Some people would argue 2 drinks are safe, and that may be the case, but I tend to err on the side of safety, and on a regular basis I wouldn't drink more than 1 drink a day. The overwhelmingly most powerful tool in our regimen to fight neuronal damage and dementia is exercise. I know we get tired of hearing this, but it is true. It works by several mechanisms. One is a mechanism of improving glucose metabolism, and it also improves overall vascular health while decreasing cortisol or adrenaline levels in our body, which are known to cause oxidative stress. We know that cardiovascular exercising or cardio, which can include walking in a zone 2 pace for say 60 to 90 minutes a week, is very helpful. Zone 2 is a pace that you can maintain your speed and can still probably talk to someone while performing this form of exercise. For me, this is 3.5 miles per hour at a 2.5% incline on a treadmill, which I do regularly. Resistance training or weightlifting has also been shown to be helpful. They suggest total body workouts 3 times per week, thus improving your overall vascular and muscular health. In our clinic, we check grip strength with all our NDVIP patients, knowing that if one's grip strength is low, this person is at high risk for fall. In addition, we also know those people in the lowest 25% of grip strength, or about 30 pounds of grip, have a much greater incidence of cognitive issues and dementia. Another often overlooked factor that is very important is sleep. You must sleep at least 7 hours a day, and using drugs like alcohol, Ambien, Xanax, they can make you unconscious, but you're not actually getting high quality sleep. We need the proper amount of deep sleep and REM sleep, that sleep you get when your eyes move and you dream. This helps our brain heal. The brain heals itself during the deep sleep, cleansing the brain of its metabolic garbage that has accumulated through the waking hours of the day. Many things affect our sleep adversely, but you must address sleep issues always, giving yourself an adequate window to get the proper sleep. Don't give yourself 5 hours of sleep when you really need 7. I plan to do an entire podcast on sleep, as it is very important to not only our mental health and cognitive health, but our cardiovascular and metabolic health. It affects everything. If it wasn't important, why would everything on the planet need to sleep? Several other issues that need addressing are hearing loss, which is not an actual cause of the dementia, but can accelerate memory loss due to social isolation. If people can't hear, they're isolated, they don't talk, they don't feel like they can be involved in conversation, so that needs to be corrected if it's present. Depression, which is also present in many, needs to be treated by seeking professional help in this area, as it does worsen memory decline. Very interesting one is dental care. Very good dental care is important, especially gum disease, which has been shown to not only adversely affect the course of dementia, but also has been linked to heart disease. One I personally have no access to, but has been discussed, is sauna use. Is another proven item. I personally can't do this, but the data suggests 4 sessions per week, 20 minutes per session at 179 degrees Fahrenheit, may have considerable help in improving overall cognitive and cardiovascular health. Some of the supplements we could include are the B vitamins, which cause a decrease in a chemical called homocysteine, an inflammatory agent in the body that is just not good. Vitamin D at around 2,000 international units per day. Omega-3 fatty acids or fish oils. Another very important is a hormone replacement therapy, especially in the first 10 years from the start of menopause in all women. This item is becoming increasingly very important in both cognitive and cardiovascular health, and I plan to address this issue in my next podcast, as this is an area I have some level of expertise and am involved in hormone replacement. In closing, I want to stress that at the point of diagnosis, when symptoms are present, it is likely that we may already be at a point of no return. We must embrace prevention long before symptoms appear. Again, what is good for the heart is good for the brain. Please address all of your risk factors aggressively, and if your provider won't, then find someone who'll remember. Find someone who will address these issues. And remember, exercise is your greatest tool in preventing any cognitive loss. And again, I wish to thank everyone for listening. Have a great evening from the Long-Gevity Lounge. Thank you.